Okay, so let's spend a bit more time talking about benign tumors or benign neoplasms. So they're typically a growing mass of cells that really lack the ability to metastasize anywhere, so to spread throughout the body, or to destroy local tissue. They don't do that either. They just gradually grow and grow and grow. So they can move other tissues out of the way, but not destroy them. Okay? The cells are very well differentiated, meaning the cells look very similar to normal cells. Okay? And typically they're very slow growing and then just gradually enlarging in an area. Now, whether we're talking about benign neoplasms or malignant neoplasms, the ending "oma" could refer to either one. So a carcinoma is a malignant neoplasm, but there's many benign neoplasms that end in "oma" as well, right? So OMA is just telling you it's some kind of tumor, but it's not telling you if it's benign or malignant. So here's some benign examples. A lipoma, which is a benign tumor of fatty tissue. And often you'll feel lipomas under someone's skin. It'll be a deposit. Typically, you'll feel it between your fingers when you move the tissue, and those are often lipomas. Hemangiomas are just a benign collection of blood-filled tissue. So they're very common in the liver, for example. When we do an ultrasound and look at the liver, we can see hemangiomas. Okay? An adenoma is just a benign tumor of epithelial tissue, such as an adenomatous polyp in the colon. Okay, so they're often just benign neoplasms. A fibroma is a benign growth on the skin or the tissue. So people that have these benign growths on the skin, often they're fibromas. And a fibroid is a benign growth on the uterus. And they can become very, very large and push in the intestines and put pressure on the bladder. But they're not malignant, so they don't destroy any local tissue and they don't metastasize at all. So these are just all examples of benign tumors or benign neoplasms. Okay, so here are some definite differences between a benign tumor, such as a lipoma under the skin, or a fibroma that's growing on the skin, or any benign neoplasm. They're often small, they're very slow growing, they don't invade or destroy tissue. Other tissue. They're very well differentiated, meaning when we look into the microscope, they basically look like the other cells in the area that are normal. And they remain localized. They never ever spread anywhere else. Okay, so benign tumors are relatively harmless. Malignant tumors or malignant neoplasms, they continually enlarge, right? They have more unregulated growth and they're typically dividing much, much more faster than benign tumors. They're invasive, so locally they just destroy whatever's around them. So for example, if you have a colon cancer, on the wall of your colon, it'll initially grow out into the lumen of the colon, but at the same time, it's going to gradually eat away and destroy the colon wall. And in fact, one of two things are going to happen if it continues. It's either going to grow so big that it's going to block the colon, leading to a bowel obstruction, or it's going to eat through the wall of the colon, leading to peritonitis. Okay? So they're very invasive wherever they are. They destroy the normal tissue. They're poorly differentiated, meaning when we look under the microscope, the cells look nothing like the cells of the area that they originally began as. They metastasize to other parts of the body. So let's use the example of a lung cancer. So a lung cancer that's locally destroying the area, but it's also metastasizing to other areas of the body, such as the bone, the brain, and the liver. So each particular malignant cancer or malignant neoplasm spreads to common areas for that cancer. Okay, so lung cancer, where does it like to go? Brain, bone, liver, and adrenal glands. Prostate cancer, where does it like to go? Often to the bone. Okay, so we know, just having studied cancers for many, many years with patients that unfortunately have them, we know where the cancers metastasize to. Okay, so there's local metastases, meaning it's locally invading and spreading as it enlarges, and it's metastasizing through the bloodstream and the lymph nodes to other parts of the body as well. Okay, so let's look at some qualities of malignant tumors. And some of these we've already spoken about. So the cells grow uncontrollably and very quickly. So they're autonomous, right? They're not under the control of the body anymore. The body has nothing to do with how these cells are growing. So they're independent of the body. They lack differentiation. So under the microscope, they look very poorly differentiated, or we call it anaplastic, meaning they look nothing like the normal cells of that area. So if you have a breast cancer, the breast tissue looks a very typical way under the microscope. But if you have a breast cancer, it'll be poorly differentiated often, and even anaplastic, meaning these cells look nothing like normal breast tissue. Okay. Often the growth is uncontrolled and disorganized. It's just growing haphazardly in different directions, and also spreading to other areas, and that's metastases, right? When you have spread to other parts of the body through the blood or lymphatic system. Cancer often evades the immunity of the body, and it just continually grows despite the immune system being present. It's able to evade and ignore the immune system. Angiogenesis is producing blood vessels that can feed the cancer. So cancers need food such as oxygen and glucose to grow. So they can stimulate growth of their own blood vessels coming off of your system. Okay? And the cancers often occur from initially dysplastic cells. Okay? And sometimes a benign tumor can become malignant, rarely, but it's possible, such as a benign mole becoming a melanoma, or a benign colon polyp developing into colon cancer over the span of years. Okay, so when someone has a colonoscopy and polyps are found, they're removed and then they're sent for microscopy to see if there's any cancer in the polyp. Okay, and that is partly why moles are followed. And if anything changes with the mole, such as the size of the mole, if it starts to bleed, if it becomes irregular in shape, then the mole is often biopsied to make sure there's no melanoma. Okay, so let's take a look at this slide, characteristics of a cancer. And this slide really has all the characteristics of a malignant neoplasm, or what's called a cancer. So number one, avoiding immune destruction, which is how the cancer continues to divide and avoids the immune system of the patient. Enables replicative immortality, meaning the cancer just keeps on dividing. There's never an end to it. It keeps on getting bigger and bigger and bigger. And the cells aren't able to control themselves in terms of stopping like a normal cell. So it just keeps on replicating. Activates invasion, so that's locally, and as well distant invasion called metastases. Induces angiogenesis, meaning it produces its own blood supply from the patient's blood supply in order to survive. Resists cell death. Okay, so the cells just keep on going through mitosis and making more and more cancerous cells. Deregulates cellular energetics. So the normal cellular processes of how a cell is controlled in terms of division and when division can slow down has been deregulated. It's just continually dividing. Sustained proliferative signaling, meaning it's just always signaling itself to keep on dividing and proliferating more and more. Okay. Evade growth suppressors. So cells often have growth suppressors when they reach a certain amount of cells. Cancers ignore that. Okay. Possess genome instability and mutation, meaning that even cancerous cells can mutate into even different cancerous cells, and that continues on, which makes cancers very difficult to treat. Since if you find a certain group of cancer cells that are sensitive to a chemotherapy agent, some of the cancer may not be sensitive because it's already mutated. Okay. Mediate a tumor-associated inflammatory response. So tumors still can initiate an inflammatory response towards the body, right? So the tumor, in a way, is fighting back at the body, and it can release all kinds of factors that can give patients symptoms from the tumor itself. So a lot of patients, for example, don't have any appetite. They begin to lose weight. They don't even like the smell of food. So a lot of those symptoms originate from the cancer itself. Okay, so just some characteristics of a typical cancer cell. Okay, so let's have a look at this sequence of slides. So in the first slide, you have healthy cells with a few cancerous cells at the surface, and this is supposed to be a cross section of a bronchial tube. Okay, so this is in the lung, and you have a few cancerous cells forming at the surface of the epithelial lining, and gradually the cells will multiply, the tumor cells, that is, since they're cancerous. Okay, so they'll they'll grow locally and invade locally. Okay, so local spread of the tumor. And finally, the cancer or the lung cancer will metastasize. And how's it going to metastasize? Well, it's going to get into the lymphatic system, which is a drainage system within the tissues of our body that drain back to lymph nodes. And lymph nodes are part of the immune system that are checking for foreign antigens or foreign invaders such as bacteria, but they're also checking for cancerous cells, right? And that's why patients with cancers often have cancer that has spread to the lymph nodes, okay? Because the cancer gets into the lymphatics. And finally, cancer can get directly into the bloodstream and travel to distant areas and set up a new cancer in those distant areas. And as I mentioned before, different cancers tend to spread to different locations. So lung cancer, very common for lung cancer to go and metastasize to the brain, to the liver, to the other lung, and it also spreads to the bone and often the adrenal glands. So we know that about lung cancer because having seen many patients over decades, it's well known where lung cancer tends to spread. And every cancer is going to have its characteristic metastasized cells that go to certain locations. Okay, so breast cancer, well, breast cancer also likes to go to the brain. It can metastasize to the liver, to the lung as a common place. So, and again, this all takes place through the lymphatics and the bloodstream. Okay. Okay, let's talk a bit about cancer classifications. So, cancers are typically classified by which tissue they originated from. Okay. By the way, I wanted to mention that when we talk about a primary cancer location, what we're referring to is where the cancer initially started. So, for example, a primary lung cancer or a primary breast cancer. It means that's where the cancer began. And then when we're talking about secondary sites, we're usually referring to the metastases. So we could say primary breast cancer with secondary metastases to the brain or to the lung, right? So whenever you see the term primary cancer, that's where the cancer began. And secondary sites are because it metastasized there. Okay, so the most common cancers are carcinomas, and carcinomas are cancers of epithelial tissue, and they make up about 80 to 90% of cancers that we see. So where are we going to see epithelial cancers that we call carcinomas? Well, how about the oral cavity, the digestive tract, the lung is epithelial, skin is epithelial. So when I say the digestive tract, I mean everything literally from oral, esophageal, stomach, small intestine, and colon. Breast tissue is epithelial, prostate cancer, uterus. So many cancers are carcinomas. Okay, and so epithelial cancers are carcinomas, and they break into two categories. adenocarcinomas, which is typically the colon and the prostate, or squamous cell carcinomas, which is typically the skin. Okay, but I think if you just know that the classification is carcinomas are by far the most common, and where do they originate from? Epithelial tissues. And then we have sarcomas. They originate in connective tissue. So what's your connective tissue? Well, muscles, bone, soft tissue, all the connective tissues that we spoke about earlier, they would be some form of a sarcoma. Okay, so if we're talking about a bone cancer, we would call it a osteosarcoma. If we were talking about a cancer of a cartilage that's lining a bone, that would be called a chondrosarcoma. Okay, if we're talking about a soft tissue cancer in a fat cell, we would call it a liposarcoma. Okay, lymphomas originate from the lymphatic tissue. So a very common one is Hodgkin's lymphoma, where you develop swollen, hard lymph nodes, typically starting in your neck. And it's often in younger people, teenagers and into your 20s. There's another one called non-Hodgkin's lymphoma, which is often lymph nodes in your chest and in your abdomen. And that's usually in a patient between the ages of 40 to 60 that develop non-Hodgkin's lymphoma. Melanomas, well, they're pigmented cells of the skin, or actually below the nails, and they are very aggressive tumors, right? They're very aggressive cancers. Myelomas are a cancer of a portion of your white blood cells called plasma cells, and we call that condition multiple myeloma. Okay, leukemias, they are a general term for white blood cell cancers. So leuc is white, so leukemias are white blood cell cancers. And there's many acute leukemias, and older people can develop chronic leukemias where they can live for many, many years with their chronic leukemia. Gliomas are nerve tissue cancers. So, for example, a glioblastoma is an aggressive brain tissue cancer. Okay, and here's some examples of carcinomas on the left, both on the skin, and these are both showing you basal cell carcinomas of the skin. Right? What's the most common cause leading to these carcinomas? UV damage from sunlight. On the right, we have an osteosarcoma, right? It's a tumor on the ulna here that you can see. So the smaller bone of the forearm has a tumor growing in it, and a tumor of the bone, osteosarcoma. Okay, on the left, that is an enlarged lymph node, right? And typically people can develop multiple large lymph nodes in Hodgkin's lymphoma, which, as I mentioned, is typically in a younger person. They often have weight loss, swollen lymph nodes in the neck. Night sweats is common in lymphomas. Luckily, in Hodgkin's lymphoma, they're very treatable with chemotherapy and radiation. Okay. Leukemias, cancers of the white blood cells. So on the left, you'd see a typical blood analysis under a microscope, where most of it is red blood cells. Okay, remember, about 40% of your blood volume is made up of red blood cells. So a huge proportion. And we'll go over that in another module. Leukemias, as you can see on the right there, the white blood cells are just packed in this peripheral smear, this under this microscopic view. So they're congested, right? And it's because the bone marrow is overproducing white blood cells when you have a leukemia. Okay, so the top right there, that circular white lesion in the brain, that is unfortunately a glioblastoma, which is a very serious brain cancer, very difficult to treat and very difficult to remove. Okay, bottom left, melanoma. And you can see with melanomas that when we're talking about changes that are concerning in skin cancers, that there's irregular borders, there's multiple colors to it, sometimes they bleed, sometimes part of the lesion is raised. So all of these images are showing you different melanomas.